Hello, I'm Matt Schwartz, chair of the Worksite Wellness Council of Louisville. Just finished a great session with Bruce Eckerly, who is a director of the Center of Health and Wellness at Sullivan University's College of Pharmacy. So Bruce, you know,
Yes.
the one big takeaway was kind of the fact that pharmacists have the ability to interact and educate. You know, they don't just stand behind the counter. So give me a sense for what do pharmacists know?
Yeah, great question, and I'd like to just emphasize that pharmacists do much more than stand behind a counter and fill your prescriptions, and they're trained to do a tremendous amount with regard to managing the medical side, the pharmaceutical side of patients' care. And they, in conjunction with your physician, can better manage your medications, the adverse reactions, the side effects, the appropriateness of the medication, whether the medication is dosed too infrequently or too frequently, at too low a dose, too high a dose, whatever the case might be. Pharmacists are trained to be experts on on your medicine, and we should rely on them much more than we currently do to provide education and knowledge around our medicines and immunizations with regard to better health.
And I guess that's the concept of medication therapy management, that whole thing, or is there another piece to MTM as you described it?
Yeah. Well, MTM is a collaboration between the pharmacist and a patient to have individual counseling around their medication regimen, and to better engage that patient around their medication, what it's for, how it works, potential adverse experiences or side effects, and maybe suggestions on changes that can be made in collaboration with the physician to better manage that patient's disease state.
So you mentioned also that obviously we have the Sullivan University College of Pharmacy, then the UK has a big school of pharmacy.
Correct.
And you said that there's some changes that have that are taking place in terms of what pharmacists are being trained to do, or how they're being trained to interact.
Correct. Correct. Yes, and pharmacy is evolving very rapidly, and probably within 5 to 10 years, you're going to have a pharmacist in every primary care physician that's going to be referred, patients are going to be referred to them for their medication counseling within a physician office, because the healthcare arena is recognizing that pharmacists are the experts around drugs and pharmaceutical care, and we should rely on them much more with regard to that knowledge.
And, you know, we had a lot of great discussion around the fact that, you know, the perception probably is that, hey, my physician is the one that prescribes it. They're the ones that went to medical school. They're the ones that know all about it. The pharmacist just counts out what I get, and we really, I mean, I am educated because it's really the opposite. A physician really has a limited knowledge of medication. So
that's correct.
I mean, you know, we had some pharmacists here that gave some examples, but give us a little thought, a couple of thoughts about that.
Absolutely. Well, not only are the pharmacists trained around disease states, but we're trained around the tools, the medications that are used to treat those disease states. So they spend literally their entire pharmacy school career understanding those medications and how they should be best utilized with regard to disease management.
So the takeaway from an employer's perspective, so if I'm an employer, I've got a lot of employees, obviously drug spend is increasing. We talked about the fact that specialty pharmacies, you know, a huge number. You know, in a couple of years, that's going to be a massive number for all health plans and what you're spending. So what would be the takeaway in terms of engaging pharmacy and how to get it more, you know, to use that help?
I would urge employers to aggressively pursue a relationship with pharmacy as part of their healthcare strategy. Not only to alleviate costs or reduce drug costs, but also to help mitigate the short and long-term costs associated with emergency department visits, hospitalizations, and other things that contribute to your overall healthcare spend.
And somebody gave an example that they felt like the swing was $3,000 annual. They looked at a large plan, and there was a $3,000 swing between compliance and non-compliance. So that certainly spend is there. And then even just individually, individuals don't understand why do they take this prescription,
right,
and what could be the impact.
Yes. MTM, for example, medication therapy management, that one-on-one counseling session with a patient around their medication regimen has shown a return on investment of as much as 12 to 1 when it comes to sheer dollars. So having that pharmacist engaged in a patient's or an employee's medication management, when in fact they're diagnosed with a couple of chronic conditions and they're taking 5 or more medications around those chronic conditions, can prove valuable in the short and long term when it comes to cost.
Well, again, it was a great session. We had a lot of great discussion around, and just maybe realization of what pharmacy can do. So if you missed it, we're here the third Thursday of most every month. So we'd love to see you at Baptist East Milestone. Thank you very much.